Most of my patients think Viagra is only about erections. That's a problem, because this class of medications can do far more than most men realize. It may sound strange that one drug could help with completely different parts of the body, but the science is heading in that direction. What if I told you these same pills may also influence your bladder, your pelvic floor, and even your metabolism? If you want more medically accurate breakdowns like this, make sure you subscribe so you don't miss anything. Let's start with tadalafil, better known as Cialis. Tadalafil is officially approved for urinary symptoms caused by prostate enlargement. Important, it does not shrink the prostate. It improves urinary flow by relaxing smooth muscle. In real patients, I consistently see fewer nighttime bathroom trips, less urinary urgency, smoother, more controlled flow. And it works surprisingly well. But the newer research suggests the story goes further than prostate symptoms. And that includes the other PDE5 inhibitors, like sildenafil. Now we step beyond well-established guidelines and into emerging science. Animal studies have found something remarkable. Sildenafil doesn't just open blood vessels. It may actually influence nerve-to-muscle communication in the pelvic floor. For example, Anderson and colleagues reported that sildenafil increased external urethral sphincter activity in mice and enhanced bladder nerve signaling. Translated into plain English, the drug appeared to help the bladder and pelvic muscles coordinate more effectively. That's a very different mechanism than better blood flow. It points to a possible neuromodulatory effect. Clinically, it could explain why some men with pelvic floor tension or lower urinary tract symptoms feel better while taking these medications. But let's stay honest. This is early science. We don't yet have large human trials proving PDE5 inhibitors as a true treatment for pelvic floor dysfunction. Still, it's an exciting lead. Now let's talk about sleep. Obstructive sleep apnea is extremely common and strongly linked to erectile dysfunction. Up to 65% of men with sleep apnea also struggle with ED. So the question becomes, if PDE5 inhibitors improve blood vessel function, could they help sleep apnea too? On the positive side, these drugs improve endothelial function. They reduce inflammation, both of which matter in sleep apnea. On the negative side, some lab studies suggest they could worsen apnea severity. This is why new scientific ideas often spark controversy. In my own clinical practice, I rarely see negative effects in patients with sleep apnea, but that does not replace controlled trials. So the takeaway is nuanced. These medications interact with sleep physiology in ways we don't fully understand yet. Any man with sleep apnea should discuss this with his physician before using them. Finally, let's look at metabolism. Non-alcoholic fatty liver disease and type 2 diabetes are exploding in prevalence. Both conditions are strongly linked to erectile dysfunction. And in animal models, the data look almost too good to be true. Chow et al. Showed that chronic sildenafil improved insulin sensitivity, reduced liver fat in obese mice. That's impressive. But in humans, the story changes. A randomized trial by Ho et al. Found better vascular function, no significant improvement in blood sugar control. Other trials show the same pattern. Vascular benefits, yes. Metabolic reversal, no. So the realistic message is this. PDE5 inhibitors won't fix your diabetes, but they may help protect your blood vessels if you have it. And remember, the higher your HbA1c, the less likely these drugs are to work for erections. Poorly controlled diabetes makes ED harder to treat, no matter what medication you use. So, what's the big picture? PDE5 inhibitors are not cures for pelvic floor dysfunction, sleep apnea, or metabolic disease, but they do influence shared biological pathways, nitric oxide, endothelial function, inflammation, that connect these conditions. In other words, when you treat ED, you may also be affecting systems involved in bladder control, pelvic function, sleep, and even metabolic health. That's why this research is so fascinating. But now comes the question every man eventually asks. What's the difference between Cialis and Viagra? And which one is actually better? If you've ever wondered that, the next video breaks it down clearly, so make sure you watch it.